Hello, my name is Dr. Eric Bricker, and I'm the Chief Medical Officer of Compass Professional Health Services. I'm a general internist, primary care physician, did my training at Johns Hopkins Hospital in Baltimore, and Compass is a technology-enabled healthcare services firm. We provide tools and support for healthcare consumers in the form of in-network price transparency and population health management, all delivered by a personal concierge or a health pro. So we work with employers to support their employees and their families, and we do this for over 1,300 employers across the country. And today we're going to talk about insurance network provider contracting, and that's a very sort of complex subject, but it's very important because that negotiating process between the insurance network and the provider is what determines the final price or the allowed amount for a healthcare service. And it creates that vast difference where at one place an MRI might be $2,500 and at another place it might be $500. So we're going to go through some of those various contract terms, okay? So the first contract term is referred to as a case rate, okay? And that's where there is a set rate or allowed amount for a particular test or service. Pretty straightforward, right? So that case rate might be $500 for an MRI at Hospital X and then $2,500 for an MRI at Hospital Y, okay? So that's a case rate. Now that case rate is completely separate from billed charges, okay? So essentially the hospital or the doctor can almost set billed charges at almost whatever they want. And so at that first hospital X that has a case rate of 500, their billed charges might only be $750. So really there's only a $250 quote unquote discount or savings there. Whereas at Hospital Y that had a case rate of $2,500, they might have had billed charges of $5,000. So you might have thought, oh, well, I'm saving $2,500 at the second hospital, so I'm saving all this money, when in fact, actually the first hospital with the lower case rate, even though you were, quote, saving less, it actually was a less expensive place. Okay, so again, when you're comparing costs, it's important to compare case rate to case rate. Okay, the second contract term is referred to as a percent of charge, and this is what folks typically think of when they think of insurance network discounts, where the final price is just a percent of the billed charges. Okay, so in this case, it might be, let's say, a 50% discount. So the final contracted amount is 50% of the billed charges. Oftentimes is used for things like outpatient surgery, let's say like carpal tunnel release or arthroscopic knee surgery, where billed charges might be $8,000 and there is a 50% percent of charge contract or a 50% discount, and so then the final allowed amount would be $4,000. The 8,000 times 0.5 gets you the $4,000. Okay. The next contract term, a little bit more complicated, it's referred to as a carve out, and that's where a specific line item in the bill, typically for something like a pacemaker or another type of implant, or like rods and screws for spinal surgery, or certain expensive infusion medications like Remicade, have a specific line item in the contract where the provider, the doctor, the hospital will be reimbursed a specific amount just for that. So in the case of a pacemaker, that carve out might be $10,000 just for the pacemaker. Or for like a knee or a hip implant, it might be $20,000 or $25,000 just for the implant itself. And that's completely separate from any other fees associated with it. So one hospital might have a carve out for a knee replacement, which means they might get an extra $25,000 for that knee surgery, whereas another hospital won't have that specific carve out. So that hospital that doesn't have the carve out would actually be $25,000 less, okay? And the fourth and the final contract term that we're gonna talk about, it's a little bit more complicated as well, and it's referred to as a provider stop loss clause, okay? So in a provider stop loss clause, this is where a hospital and an insurance network will negotiate, let's say a case rate, oftentimes for more complex surgery, and that case rate might be $10,000, okay? But that's only up to a certain amount of billed charges. Let's say billed charges of $40,000. So if billed charges are $39,000, then the case rate of $10,000 applies, right? But as soon as the billed charges hit $40,001, then the contract flips from a case rate to a percent of charge contract. And that percent of charge is typically only like 10% off of billed charges or 25% off of billed charges. So as soon as that billed charges hits $40,001, then the allowed amount then increases from $10,000 to $30,000, or 40,000 times 0.75 gets you the 30,000, okay? So obviously when Compass is talking to our members in regards to what a particular test or service costs, we don't use these terms like case rate and percent of charge. We put things in terms of just layman's terms. but it's very important to understand that kind of beneath the surface, there's all this contracting complexity that's going on that is causing these wide variations in pricing. So to learn more about healthcare pricing, Compass actually has a whole bunch of information on our blog about this. We also have a free ebook available as well. So please come to our Compass blog to learn more about that. Thank you so much.